We are live. Hello, good morning.
Hi.
Alrighty, so April 1st, April
Yes.
1, 2022. So this is Dr. Helene Nguyen and this is Dr. Young Zhu. So we both here today to celebrate our 15 years anniversary of Feed and Beyond, and a little bit interactions, hopefully, that we just engage with our patients and any public that who can always welcome to join us and be able to give us any input, feedback, and we here to continue to provide foot care and foot health, and we dedicate from day one when we start Feed and Beyond as our practice. All right.
Yeah.
So how about let's start with the share your feeling, Dr. Zhu. We started this journey 15 years ago, right? From coming out from our training and start working, and we have this vision to be able to provide the excellent care at the different, actually, as an the most advanced technologies and using our knowledge to provide foot health for the patient in the community. Start out from the hospital setting, and now we're in more of community aspect of it. So what's your thought? Like 15 years ago, right?
15 years ago, we opened our doors today, actually. That's why we're having the live event this morning. It is a very scary thought 15 years ago to start an office, open our doors, and I believe we saw about 5 patients total between Dr. Nguyen and myself. And at that time, we were pretty much a facility-based office, meaning that we went to the hospital, we went to a nursing home, and our office was a kind of like a background triage, meaning that, that was not our priority. It was a office that took care of the patients that got discharged from those facilities, and we had to have a place to accommodate their after needs. And that's was the primary reason we started our office. 15 years ago was a different times. Times have certainly changed, but back in that time, a lot of us who graduated from residency training, graduated from medical schools, at that time, we were just thinking about, working for a hospital, working for a facility, working for someone to pretty much get our career started. I never thought that 15 years later, we would have a full-time office where everything could be done in our office now. Everything elective could be done in our office. So that is a accomplishment that, I cannot just take credit for myself, but, it's the entire team. Past staff members, current staff members, every team member that has come and gone, who has helped us out. And, even though people have changed, time has changed, we're 15 years older, memory remains. And thinking back 15 years, a lot of team members has come and gone, family has come and gone. But it seems like we always had the help that we needed. And that's very important. Team members showed up and they gave us the help and then they move on. Same thing with family. So I think that's what stayed with me for the last 15 years. Looking back, all the memories and all the dedication and, hospital-based practice for a short period of time there for about the first 3 years. It was a lot of midnight calls to the hospital. I remember one case doing surgery at midnight. And after we done with surgery, we thought it was over. And I remember Dr. Nguyen had to hold a family meeting in the patient's room with 20 family members asking her questions. taking nursing home calls where patient from the nursing home needed help at all hours and on Sundays. But it's the dedication that, brought us all the way to here today. I think that's what stands out the most, which is the memories.
Yeah, so definitely those memories, whether it's good or bad memories, is carry with us, and it's make us where we are now. Definitely agree with Dr. Zhu that we cannot do this alone. Dr. Zhu and I, we've been in this industry, in this business of take care of people's feet. But of course, the whole team is the one that we are, give a shout out to.
Yeah.
We cannot do this alone,
Yes.
just try to emphasize with Dr. Zhu, like whether past staff member or current staff member, we always appreciate the hard work, the commitment to be part of the team. And I think that is everybody really aligned with the visions of what we try to do, what is Feet and Beyond try to do to provide the good foot health to everyone, whoever that we can reach. And our message is would like to spreading the brand of the technologies using our knowledge and up-to-date innovative approach to take care of the people, right? To
Right.
take care of patients, whether from as young as a few months old to as old as like 100 years old plus, so that's what we're here for.
Yeah. And I think that's why, when we came up with the name, when Dr. Nguyen came up with the name Feet and Beyond, it sounded silly when we first started. Even our family member laughed at us. I specifically remember people asked us, is it like a play on the name of Bed Bath and Beyond? Feet and Beyond. So, that's actually one of the most common questions we get asked in our office. What's beyond? Obviously, podiatrists take care of feet, and that's what we do. In the state of New Jersey, we take care of foot and ankle problems. And that's actually an evolution of what podiatrists used to do and what we do today. The beyond part, I recorded a short video, which is up on our website and YouTube and things like that. So you could go and look at the details of it. But the beyond part is actually, what we dedicate our career to hone our skills to take care of patients' feet, but it's beyond their feet. It's what they do with their feet that we, mostly concerned about. Then that's usually what our first question we ask our patients. What do you do? When does your foot pain happen? How often it happens? What does your foot pain stop you from doing? Pain is just a symptom, but there's also always an underlying cause. And we want to know what the underlying cause is. So that's beyond the pain part. And what would you like to do? And what's your pain stops you? What's your anxiety? What keeps you up at night? So that's the beyond part. That's the part we want to treat. We want to treat the whole person. And I think that's what makes us come to work every day and want to make sure that every patient get the attention that they need. I always say to everyone, one diagnosis, but with two different patients may have totally two different courses of treatment and processes. So we sit down and we talk to our patients. We go beyond just looking at your feet, telling you what the treatment is, and hope the treatment will work. We customize our treatment, to the person's condition, diagnosis, what they would like to do if they didn't have foot pain. We take into account, their age, their activity level, their job, their careers, and how active they are. those are all important. So I think that's to get that out of the way of one of our most common questions is like, what's the beyond part? And we usually joke around and say, feet and beyond part is the ankle, because in New Jersey, we're allowed to take care of the ankle. And that's just a kind of like an inside joke, but it is a fact that we could take care of foot and ankle in New Jersey, in the state of New Jersey. Different states have different practicalities and scope of practice. But beyond part is really the part where Dr. Nguyen and I sit down with our patients. And even before we look at the patient's feet, most of the time we spend anywhere between 5 to 15 minutes talking to our patients about what brings them in, what's their angst, what keeps them up at night. Pretty much a Jersey saying is from soup to nuts, what brings you in that day and what is the issue.
Mhm. Yeah. So I just want to take this moment to to kind of like see who are the viewers on our Facebook Live right now. We do send out invitation to our friends, our colleagues, our patients, and also in public arena as well. So yeah, shout out to Dr. Larry Kale. He's my colleague. I get to know him a brief period of time on my part of my journey of minimal invasive. And now we become a good friends. Now we're talking about like 3 years going on 4 years. I get to know him, and I consider him as best friend. Also, one of my very close MIS mentor that he been practice minimal invasive surgery and in Florida, and he's a Jersey native, but he uprooted and moved to Florida. So hi, Larry. Thank you for joining us this morning. Okay. And we also have Margaret Richard. Thank you for joining us. So if you have any questions, just kind of like post on the comments and we'll be able to address that, during, in between our conversation. Yeah. So yeah, we also have who is this? Maria Triano? Oh, okay. So that's just one of the viewer as well. So hi, Maria. So looking forward to connect with you. That's for sure. So let's you share, Dr. Zhu, you share your your feeling and your conversation with patients in the exam room, right? And most of my patients also, one of the top questions is like, what is a beyond part as well? So we kind of have a different version, how we answer that questions. For me, people look at me, think about beauty and stuff. So they ask like, do you guys have foot spa in the back? Do you guys have like take care of like all the like vein and all of that? Yeah, so we are not. we want to focus on the medical side of it and podiatric care, foot and ankle problems, and we be able to address the issues clinically with the patient. We don't know what future will come. We like 15 years ago when we opened our door to serving the community, we never thought that we would have move into having the surgical suite in our office. We have staff, and now 15 years ago, we never thought that this day would happen. We young kids, both of us, we young, we just want to work hard. We want to do whatever we can to provide the care, and without having any of thinking about what is not possible, right? But now we think that now look back, whatever we envision, that we do feel that right now. Sometimes I'm sure that you have one of those feelings. We're sitting in our waiting room and just look around. And it's like 15 years already. Yeah. Just like how I feel reminiscing yesterday after my clinical day, I walk around, it's like 15 years already. And we've been in this space, we've been in this environment, continue to take care of patients, continue to give them the most innovative approach to allow them to get back doing what they love. Whether just get back to work, just playing with their grandkids, or even just be healthy, be a a good athlete, in school or high school or middle school without any foot pain. And I think that it is something for me, is such a gratification, so that is,
Yes.
I don't know, for me, every patient is a different feeling.
Yes.
We've been in practice, we graduate in like 2003,
Mhm.
right? And we've been in training,
Mhm.
and we practice podiatry like more than 15 years.
Yes.
So definitely that is something, it says something about our commitment to the profession.
Yes.
We learn to love podiatry again after go through a lot of ups and downs with being a business owner, as well as committed doctor to take care of the patient. So definitely that is meant so much for us when we get to this milestone of 15 years. And maybe we never thought that would happen, but now here we are, 15 years, and yeah, it is quite emotional. Like of course I don't want to be all like, but I guess it's one of those moments that we cannot forget whatever that happened and we went through. Yeah, so just a little shout out to Pat, Lorraine. Oh, hi Lorraine, how are you? Larry, that's Dr. Larry Bass. He's also a minimally invasive surgeon.
He gives his best to all his patients.
That's
I'm
right.
sure.
So he's also one of the colleagues that I really get work together, learning from each other through our minimally invasive journey, which is, we're going to talk about that later, like how we transform our practice using this very specific techniques and approach that will be able to help so much more of the patient, and that will be fulfill our vision of what we do here at Feed and Beyond.
Yeah, I think, when you hit 15 years, and thank you for all that has joined us and listening in again. If you have any questions or anything to ask Dr. Nguyen or myself, feel free to type it in. This is an interactive live session. I enjoy talking, and I hope you enjoy listening to, us talking, but we would like to make it, interactive. I think, when you hit 15 years, and we have two colleagues here that has literally lapped us in their experience. Both have over 30 years of experience and practice. So 15 years is quite a bit to us, but not to the colleagues that are joining. So maybe in the next 15 years, we'll have a foot spa or a massage reflexology in the back, or the state of New Jersey changed their law so we can have a nail salon along with our practice. Who knows what next 15 years will bring, right? But when you hit a milestone, and we always go by 5, 10, 15 years as a milestone, you look back to the beginning, which is what I talked about before, starting our practice cold. For those of you who don't know what that means, is literally have no patient base. We just open our doors, hang a sign outside, and hopefully people will notice us. And, hopefully doctors will refer their patients to us. And, our name in the community will develop. That was the hope. And, that journey started, in 2007. But you also look towards the future too. And when you hit a milestone like this, yes, like Dr. Nguyen said, there are times where when I'm in the office alone, I, walk around, sit somewhere, put myself where the patients would sit. I would actually literally sit in the waiting area. And first of all, I would think, this is all ours, meaning that it's Dr. Nguyen, myself, and the team members who helped develop this, decorate the office, actually help paint the office. Part of our office, we renovated about 5 years ago, and all the team members literally came in their jeans, overalls, and dirty t-shirts and paint the office. So we all have a part in this. And there were trials and tribulations, like Dr. Nguyen say. I remember there was a time where we both were thinking about, what, let's shut down the office, go back and work for a hospital, sell our practice for sustainability, for the good of the community to continue to provide care, but not allow the business side to compress us down, stress us out. There were times like that. And that's what Dr. Nguyen mean by, at this point, 15 years later, we're almost like a born again podiatrist. We found our new way again, which I'm gonna have Dr. Nguyen talk about in a little bit. But at this point, just for full disclosure, for those of us who's joining us and who will watch this video later, all right, Dr. Nguyen and myself are husband and wife team, all right, even though we have two different last names.
We don't want confusion.
Right, exactly. So full disclosure to the community. Everybody knows it. It's not a secret. Dr. Nguyen and myself are husband and wife team. We both met at school, just give you some background. She's a Midwest girl from Chicago. I've been raised in New Jersey. I immigrated to New Jersey when I was 10 years old and stay ever since. I grew up in Elizabeth, moved to Woodbridge, and I actually did not want to be a podiatrist when I was growing up. Short story is I actually want to become an architect. It was my lifelong dream. Podiatrist was one of those things that was serendipitously, fate came to me. It was a calling. It kind of fulfilled two things in my life. One was I found a career. Two, New York Podiatry School was in Manhattan, and I always wanted to live in New York City one time in my life. So I got to fulfill those two things when I graduated from Rutgers University. At that time, I met Dr. Nguyen at school. First day of medical school, we met each other.
It wasn't love at first sight.
It was not love at first sight, just to get that clarity too.
Too old for that?
Yes. It was not a fairy tale or anything like that. But we were, like Dr. Nguyen said, we were two 22-year-olds living in, Manhattan, New York City. She did her residency training in Jamaica, Queens. I did my residency training in Staten Island. So we got to spend about 8 years in New York to kind of live out our, youngster's dream or whatnot of just having the best of two worlds, and then in 2005, 2006, we moved to New Jersey, got married, and settled and started our office at that time in Elizabeth, full circle, the city where I grew up, believe it or not. I never thought I would have a practice, an office in my hometown. Had was taking care of patients in 2 nursing homes, 2 hospitals, so on and so forth. And, as any family would at that point, we think about settling down, so on and so forth. And that's actually how we found Hackettstown, New Jersey. And then we started our part-time office at that point. So that's kind of like the short of, what brought us here today. And 15 years later, like Dr. Nguyen say, we never thought that this would, happen this long. And like I said, there were times where we just said, this was getting a little too much, which we will discuss in a little bit as well, what is too much and how medicine has changed, in the last, I'm sure Dr. Bass and Dr. Kales, went through it much more than us knows, but we were on the tail end of, the days of HMO insurance, Medicare changes, Obamacare, so on and so forth. And that was a really trying times. But, let's get back to the, the transformation of our office. and why we are doing what we're doing. And 15 years later, here we are.
Yeah, so you kind of like hear what Dr. Zhu's history of how he became a podiatrist. Kind of little intro that for those who do not know us, or haven't heard our story. I grew up in Chicago. Growing up in Chicago, and I make the decision to be a doctor after the very, I think it's a very much like the moment when I realized that why I want to be in medicine. That's when my grandma, who is my mom's mother, underwent heart surgery at the hospital, and she passed away. Unfortunately, she didn't make it. And at such a young age, and I just feel that something is missing, because I wasn't able to get any answer from any of my family members. What's the reason that grandma never could make it out, never come back? And I think that it's kind of motivate me to be in the operating room, I would say, surgical environment, just to find out what went on, and what what would make someone not getting better. And I think that it's just a curiosity. It just motivate me and inspire me through high school, and decided to go to pre-med program. It's podiatry, again, is not my first choice. It wasn't my first choice neither. Podiatry is actually an accidental, finding, I would say, discovery. That when during the pre-med program, and I get to meet the doctors, the primary care doctor who took care of my dad when at that time he recently diagnosed with diabetes. And he mentions that, Mr. Nguyen, you need to see a few doctors, specialists, just to follow up, since that you newly diagnosed, and find out if there are any different part of your bodies that compromised. So one of the specialists that he recommend or refer to is podiatrist. And that's when I started looking into that. I know all the different specialists, but podiatry is, to me, I didn't even know there's a whole subspecialty of ortho or surgery focus on foot and ankle problems. So I start looking up on that, being curious. And so I start looking it up, and so follow a local podiatrist in town, and podiatry. So now at that time, back now it's like almost 20 years ago, that we're not sure that how much I can learn, how much am I made for podiatry, or is that something that I would like to be committed for almost the rest of my life with. It's like one of those moments that I think that's the first biggest decision I made, that is to go toward podiatry. And I found that podiatry still holds now, that is allow me as a female, being a doctor, have time for my family, be able to fulfill my desire of being operating being a surgeon, and be able to help patients. So I think that it seemed like have a very good way and good career choice. So I decided to go into podiatry, and that's how my journey started in podiatry. And believe it or not, I grew up in a very protective Asian family. To be able to detach or uproot myself from Chicago and move to New York for school is a big deal. It was a big deal for my family, a lot of support. And I think that as right now, I'm still saying East Coast, and I think sometimes my family back home still wonder, like, what happened? I thought you're gonna come back to Midwest and practice. What happened? You stuck here. Well, thanks to this one right here. He got me a job in Elizabeth. So he knew that the only way to keep me in East Coast is to propose to me. So he made the proposal toward the end of my residency training. And of course, right back at that time, when that happened, of course, I cannot find a job outside New Jersey or, or in East Coast area to be away from him. So we make that commitment and we make that, decisions. And here we are. We are 15 years later, still thinking, that's like yesterday. A lot of things that we learned, a lot of things that we went through. We did not have a start like a traditional way. And I would say a podiatrist who start out. We start out in the hospital setting. We start out working very closely with the wound care center setting. And we start building our career at that point. At that time, our only somewhat a private office is actually go to nursing home. And we subletting one of the vascular doctor's office on the weekend so we can see a routine patient. That's also had to be, we had to give a shout out to Dr. Joseph Lin and Dr. Tsai. They are our very initial the vascular surgeon and a primary care doctor who also our primary care doctor at that time. Be able to connect with us, with the community in Elizabeth area, with the administrator at the Trinitas Hospital, and be able to start our career at that time. And that is like our side gig at that time. We not really call it, we didn't even have Feet and Beyond yet. And on our other day that we will go to the hospital at the wound care center to take care of wound care patient and very in acute setting perspective. And I think we kind of get bored with that environment. Or maybe for me, I think that, when, as if anyone didn't know me, my vision is sometimes is get ahead of myself sometimes. And I don't like to be just status quo. And I think that that the most. So I see that there's something more that I can do. I can do not just at the hospital setting. And that's when we start our practice. And that's how Feet and Beyond, being found and created to offer the solution, not just for, at the acute setting, acute problem, including, infections and, wounds and very severe that require people be in the hospital for admissions and stuff. This is not what I'm talking about. It's just like a routine foot problem, foot deformity that will stop patient or people slow down their activities. This is like bunion, hematomes, heel pain, wart, just even fungal toenail. Those kind of things. Some people may think that it's just so minor problem, but it's meant something to someone. It's meant something to someone that they will make a phone call to a podiatrist office to take care of it. And that is something most of the time that we don't think about it so much. If we inundated with the so many patients, 5 or 10 minutes with a patient, we may not be able to get there. So we see that approach, and we did that. We went through that for 10 years of our practice, that we at the hospital during some days of the week, and then we start with the office patient. And at that time, we don't have that many patients, but we do have good follower. We still have some patients still seeing us for 15 years. Some unfortunately is move away, some unfortunately pass away. So, but we're still here to continue to provide the care. They move away and they still come back to Hackensack, travel like 2 hours away to come back to see us. So that is really meant a lot for us, and kind of like confirm what the decision that we made, and continue to move on and move forward with that kind of confirmation.
Yes.
Yeah, so let me just pause real quick, and we have a few more viewer.
Excuse me.
Miriam. Hi, how are you? So thank you for joining our Facebook Live here. And we have Michael DeMayo. Yes, hi, yes. Well, I'm happy that to see more people joining us this morning. So just get to know us, and you can always come by and say hi to us throughout the month. That's for sure. You know, if you don't know us, we very approachable. Sometimes we see people, it's a small town. We have a small town atmosphere. We have no problem with running to patient. We see that all the time. Of course, with the COVID and pandemic, I think, I'm not sure how you feel that we've been wearing masks and patients come to see us, start out new patient during the pandemic, wear masks, and they got discharged. And now I have no idea what they look like. Sometimes, and I kind of miss that.
Yeah. You know, sometimes, you know, in a setting like this, it's casual talking, right? You know, our patients always have common questions for us, like, what's the beyond part? You know, is this a family business? Like, you know, because Dr. Nguyen has a sister, and she's you know, she's part of our team, and they look very much alike. So, you know, are we a family business? Are we husband and wife? You know, so on and so forth. You know, we not only have a practice in Hackettstown, we actually live in Hackettstown as well. So we are part of your community. So whatever happens to our neighbors, whatever affects you, it affects us too, not only on a professional level, but we live here too. We have a 7-year-old. So we're part of the community, we're part of the fabric of the community. We understand what this community needs and want to see, you know, having a service of a podiatry office. So yeah, like Dr. Nguyen say, whenever we go out on the weekends to shopping, to fun, to the park or whatnot, we always have patients who spot us out, even during COVID times. I have patients who say hi to me that, you know, I'm in a mask, hat, sunglasses, and somehow they recognize me. So that tells us that, you know, somehow we're doing something right. We're recognizable, we're approachable, you know, definitely, you know, we are, we have our pulse, we feel the pulse of the community and all the changes that has happened in the last 15 years. I believe we had our practice here for 15 years, and we also live here for about 16 years, 15 years or so. So that was a milestone that year between 2006 and 2007. We bought a house and, you know, start to live in the community and practice in the community. And, you know, with that said, I think, you know, I think we should talk a little bit about, you know, what we do and how we serve that community. And, you know, what do I mean by we have a sense of what the community wants. You know, 15 years ago when we started our practice, just think back yourselves, whoever's watching this later, you know, what we have been doing, you know, 15 years ago, 2007, you know, that was a different times. I mean, 15 years ago, you know, iPhone was in its infancy, you know, Amazon was in its infancy at that time.
We have a flip phone at that time.
Yeah, we have a flip phone at that time.
We think that we hip.
We were hip to have a BlackBerry at that time. A Palm Pilot, you know, having Wi-Fi. The first time I heard of Wi-Fi, I'm like, what? I could walk around and have internet? You know, that was 15 years ago. You know, I did a little research myself, what was, you know, in vogue in 2007. And feel free to do so yourself. I don't want to date ourselves here and how, you know, what my younger staff member would call me as an old head. You know, we have staff members who are in their like late 20s, early 30s. And, you know, 15 years ago, they were in high school. You know, so this is how times has changed. You know, people change. You know, at that time, it was okay to take every insurance under the sun that the government had to offer. Companies was different what they were offering. people's lives was a little different 15 years ago. Not so today. Times has changed. I don't have to tell you how COVID has changed our lives in the last 2 years. But even before that, things move faster. People don't have the luxury of time off anymore. Kids' lives has moved faster, so parents has moved faster. Grandparents are the caretakers now of the younger members of the family. So with all those things said, we also made some changes in our office. And I think that's what us work well together, Dr. Nguyen and myself. She's really the visionary person in the office. I'm not a visionary. I just do what need to get done. So she saw the changes where, let's take procedures and surgeries, for example. People don't have the luxury of taking 4 weeks off to fix let's say a bunion, which is one of the most common conditions we see, which is 4 weeks non-weight bearing, then another 2 to 4 weeks in a boot, and another 4 to 6 weeks of rehabbing time, meaning physical therapy. If you add all those times up, the worst case scenario was 3 months out of commission. Nobody has that time nowadays. I know we don't. We have a 7-year-old, we have one kid, and we feel like we're a couple steps behind with things at school, his social life, our family, our extended family. We feel like we're a step behind. I can't imagine if somebody tells me that I had to take 3 months out of commission or change my life for 3 months, where I had to wear a cast on crutches for 4 weeks, then 4 weeks in the boot, then another 4 weeks in rehab. I don't have time for that. And that's a statement not of aesthetics or anything. It's just true fact. Even an ingrown nail. We're a working class community here. Everybody goes to work. Even doing an ingrown nail, someone the old traditional way, sometimes patient might have to take 7 to 10 days off if they are in a job that is a little contaminated, a little too much on their feet, little soiling of their shoe gear. They have to take 7 days off work. I mean, typical companies now, they don't give that much paid time off. So all those things, made Dr. Nguyen saw that and made changes in our office and continue to move forward. And technology has had to catch up to our lifestyle. And that's just simple fact, So that's why the two mainstays in our office now, as you could see here, Center for Minimum Invasive Surgery. And we have implemented other technologies in innovative ways to accommodate for that just one thing, which is time off or being laid up. There are so many other factors that stop people from getting treatment on their feet. Another one is age. Traditional way of surgery limited patients at a certain age group. Standard of care was like, you don't do surgery. But Dr. Nguyen wanted to help patients, the ones that are active. We're living much longer now as a society. Caretakers who cannot take time off, but they still want their feet to be good so they could continue to care for their family member, take care of their grandkids, not scare their grandkids because of their crooked toes. At some point, standard of care was, okay, when you reach a certain age, you don't do anything about your foot. Diabetes was another thing. Dr. Nguyen said we started in a part of our starting of our career was at a wound center. We saw wounds anywhere between 3 to 5 days a week. And again, it was like, if you have diabetes, you don't do surgery. But then how can you get the wound healed? So those were the three main factors for Dr. Nguyen to rethink our office and brought in minimally invasive surgery. And I'll have her talk about a little bit. And then, serendipitously, again, serendipity sometimes happens, fate happens. Along came with minimally invasive surgery is our own procedure suite or surgical suite. That happened right before COVID. And when COVID happened, elective procedures stopped. But what defined as elective procedure was not elective to us. People were still getting hurt. People were actually getting more injuries because they were at home at that point, playing with their kids. They were getting more injuries. They were getting more ingrown nails. They were getting warts, or they had something, but they can never take time off to take care of it. All of a sudden, we were all home, and we were able to be more aware at that point. So our in-office procedure suite helped a lot of patients that had infections, had wounds, and we were able to continue serving the community, without going to a hospital or a surgery center, which was closed down during COVID. For a good 6 months, no elective surgery was happening. So, I'll leave it up to Dr. Nguyen now to talk about, minimally invasive surgery, our own surgical suite, and other innovative techniques that we have implemented in our office in the past 2 to 3 years.
Yeah, so like I mentioned already, I love being in the operating room environment. I love to make a difference because I think that's when, podiatry particularly, that is so different than other specialty. It's not that because I'm podiatrist, I say that. It definitely that we see patient limped in our office and be able to walk out with relief. And yes, there are conditions that, if the condition so debilitate them, doesn't matter, a visit 5 minutes with me or 30 minutes with me, it may not resolve that. And we may need to resort into the solution, the surgical solution to intervene that. We always start out with the conservative option, and then we move step up if whatever that we provided is no longer a viable or like significant improve the patient quality of care. So back then, when we see so many things happen, especially with a traditional surgical approach, it has a certain limitation like Dr. Zhu say, the age, the downtime, the recovery time. And sometimes that they just a thought of having foot surgery is scary to a lot of people. And when they came to see us in the office, we offer them the conservative option. And then once those conservative option is kind of like maxed out, we very hesitate to offer the surgical solution for them because the downtime, they not be able to take time off from work, from doing whatever they're doing. The the age, like for older patient with compromised medical conditions, is not something that they would like to or medically clear or candidate for the surgery. So those are the things, I believe definitely the two big factor that is really bother me 8 years ago when we decided to make this this commitment. And I like Dr. Zhu say, like serendipitously, that I follow one of my now become my mentor and his program about minimally invasive surgery. I got exposed. Good thing that fortunately for me during my surgical training, I did came across a few minimally invasive cases done by plastic surgeon. So at that time when we came out from our training, that is not the in vogue. That is definitely hardware and new fixation is in. We see healthcare has been very strongly influenced by pharmaceutical and hardware companies because it just think that is a better option. But now, as we see, we look back, they have a alternative. It's an alternative that allow me to continue to care for the patient beyond 65. There are with the surgical intervention, there are the solution that allow me to help the patient get back on their feet shorter than 2 months out. Anytime that if anybody who know anyone have foot surgery, they're debilitated. They completely off weight bearing for a certain period of time and laid up. That's why they always say that, oh, surgery had to be the last option. But with our tagline, and actually our marketing coordinator, I have to give him credit for that, is, surgical option, it doesn't have to be the last resort. We have a solution for it, and we'll be able to bring the patient, get the patient back on their feet and do what they love. And they can be the hero of their family, that be able to work and continue to work, make money, for younger working class, and for the older patient, that they be able to have a solution rather than just live with their foot condition. I just want to share one quick story that, that's really touched me, that one of my patients, she was 92 years old, have very severe bunion deformity. So for those of you who don't know what is bunion deformity is, it's a big bump on the inside of the big toe. And this bump is being so irritated. She didn't really have pain when she moved her joint, but the bump is constantly rubbing against her shoes whenever she wears shoes. She cannot find any other shoes can accommodate with that problem. And she loves shoes. And she actually walked in for the free consultation that I saw, and she had her shoes cut out so that her bunion bump doesn't rub on that anymore. 92 years old. And she's active, very active, 92 years old. Like Dr. Zhu said, that we live longer, we be more active now than ever, because especially after pandemic, we want to be healthier. We want to be there for our family, because life is very important now. We value our family and being around them. So this patient, senior, got turned down by many doctors because she's not surgically candidate to get her bunion correction or fixed, or at least they give her that relief. And that's really give me that push to move forward to minimal invasive approach. And the techniques that we're using is not something brand new. It's been there. There are doctors that's been in practice, like Dr. Larry Kale. He's been in practice for 40 years, and this techniques has been out there for so long and been perfected like throughout the years. It's just that it's kind of like under the radar, because when the whole environment of healthcare, everything is about hardware. So, it's become like the minority in the surgeon arena. But this technique has been proven and perfected for so long. And I got, I'm one of those, I can call myself as a latecomer, to MIS at that time. That's like 4 or 5 years ago. And that's when I make a full decisions. After, at that time, my son was 2 years old. Mm-hmm. Am I ready to learn another, or perfecting another new skill, what I call as a new skill, because a little bit different. This technique is done on all the incision, all the corrections on the bone, done under the skin, and with a very tiny portal, literally as tiny as 2 millimeters. So with the traditional, being a traditional surgeon trained, that you had to open everything out, layer of skin, and get to the bone and to correct those. But this is a technique that we be able to do that without looking directly at what we work on. How does that happen? It's like magic. And I'm sure that like Dr. Kell and Dr. Baskin, like, contest to this, it's like we do magic to patients' feet and be able to give that correction, realign their joint, and let them get rid of the pain, relieve the pain, and get them back on their feet so much sooner, because the corrections or the area that we worked in is only directly on that area, not compromised with other soft tissue structure. soft tissue like bone, tendons, ligament, everything that connects to the bone, to the joint itself. So those, like, one of the approach that we make that switch, we make that shift in our practice. And one of the great thing about this technique that we be able to do in office with no sedation. Everybody who been or know someone who goes through surgery always go under anesthesia. And that is make it a safe procedure for older patients, because there are medical issues. It's not clear, not equipped for them to go into sedation. Cardiologists love this procedure because they don't have to clear the patient for it, because there's no EKG needed. The only thing that we just make sure that the patient's medication is, like, dosing properly so that they can be safe and optimize that healing progression. So those are the one of those kind of one of a benefit, I would say, a benefit of this procedure. And we definitely, there are conditions that will still require traditional approach to correct it. I mean, not everything can be corrected with minimal invasive approach, but most of the common foot deformity that make the patient slow down their activity, they're embarrassed of their feet, they just not be able to wear their favorite shoes anymore, or not be able to doing the activity that they love, like hiking, skiing, snowboarding, whatever that they like to do. And we be able to give that solution for them. And to me, that is such a game changer in certain techniques that, I mean, I still wow myself every day. Every time I see patient, I perform procedure on patient, it's wow me. And I've been telling my patients that I've been in practice for 17 years. I see so many toes, and no toes are alike, no feet are alike, no foot are alike. So everybody that what we give here, and whoever being our patient, I'm sure that you know how we feel about our relation between us and you guys, and ladies, that we really listen to you. We care for your, not just the problem itself, but your future of your quality of life. And I think with that aligned with like minimal invasive approach, it kind of bring that together. And then we have other services that doesn't require any surgery. Like, one of the things Dr. Zhu gonna had a video about that, which is, just follow us and subscribe to us on YouTube channel, that he gonna talk about Untitled. It's one of like non-surgical solution for ingrown toenail. So if anybody have ingrown toenail, they know they have ingrown toenail and how painful that is. So so when you have painful ingrown toenail, do you want to get, like, when you're in so much pain, doesn't care like what the doctor do to you, as long as get that ingrown part out, then you happy. But that is a solution that no needles, no numbing medication. And there are patients really scared of needle too. So we found out a lot of things. And so all this observation, all this thing that we talk out, it's all come from the years of experience. We listen to the patient, we listen to what they fear of, what keep them up at night, what they're concerned about any foot correction, foot procedure. It's all coming all together. And I think this is 15 years is give us the opportunity to like relive it and then see what we can improve in the future. And I think that's where we are right now.
Well, I want to just take a moment to thank all our current and former patients that have signed in. Most of them have gone through minimally invasive procedure with Dr. Nguyen, and they all have very excellent results. So thank you for all that has logged in. And Dr. Nguyen's mentor also logged in, Dr. An, thank you. I think to add on to Dr. Nguyen's point, to just as a kind of conclude this segment, I think, we listen to our patients, and that's, like I said from the beginning, that's where we begin our journey together as a patient-doctor relationship. We listen to the patients. What is their problem? then we offer a solution or we propose a solution. And time again, some solutions are not for certain patients, whether that's because of downtime, because of pain, because of anesthesia, going to a surgery center, go to a hospital, whatever it is, we were not able to solve every one of those solutions or problems. I think minimally invasive surgery gave us new hope, gave patients new hope, gave us doctors hope to, take care of some of those concerns. Minimally invasive surgery, Dr. Nguyen does this, I do not. So whoever's interested in minimally invasive surgery, go see Dr. Nguyen. But I think,
spokesperson.
right, I have seen it. Like some of the patients that are here right now are started with me, and I refer them to Dr. Nguyen. But it solves the problem of age limitation, not be able to clear for traditional surgery under general anesthesia or sedation anesthesia. It solves the problem of medical conditions of, let's say, diabetes, cannot have surgery because of diabetes. It solves the problem of downtime. Our patients walk on the same day. They have surgery in our office suite under local anesthesia only. They're awake the whole time. No hardware. For those who are concerned about living with screws, pins, plates, the rest of their life, and they have a bunion that they want to fix when they're 50, they won't want to live the next 50 years with some pins or screws in their foot. So it solves a lot of those issues, and our patients walk on the same day. And a typical recovery for MIS procedure or minimally invasive surgery procedure, depending on the procedure, of course, is anywhere between 2 to 6 weeks, like full recovery, like back to normal life in about 6 weeks. So I think, minimally invasive surgery solve a lot of the issues, a lot of the hesitancy, and gives the doctor options to offer to our patients that accommodate to their lifestyle, their current lifestyle. So like Dr. Nguyen say, we work on a patient that's 92 years old and as young as 16 with minimally invasive procedure. So this is something that, yes, it is a game changer, not only for the patient, but for the doctor as well. And there are so many other innovative techniques that we have implemented in our office. Like Dr. Nguyen said, Unifix is one of them. There is a whole page on our website about it. But pretty much for those of you who had ingrown nails or having an ingrown nail, I don't have to tell you how painful that is and how bothersome that is, how infectious it could get, how ugly it could look. Traditionally speaking, 2 or 3 needles in the toe, rip the nail out, burn the nail root, 7-day downtime. Again, not many people I know have that or want to go through that. In our 15 years in practice, we never had a patient that come to us and say, yeah, give me a needle, I love it. Never had that. Yeah, rip this nail and burn the nail root. I really don't care what happens after that. Never happens. Unifix changes all of that. It's a non-surgical, non-needle, no pain, same-day procedure in our office with no downtime. And again, that's a solution that I could provide for my patients. And like I said on my YouTube video, it's not a pleasant condition for us doctors to treat either. It's horrible for the patient, but it's not pleasant for the doctor either. Believe it or not, we took an oath to not hurt anyone, to provide care. And what we do here at Feet and Beyond is that, we provide care with the most innovative, effective, and the safest way possible. And those are just 2 ways that we do that. And that's kind of what we hear from like Dr. Nguyen said, that's what we hear from our patients, and that's what we want to provide as much as we can. Like Dr. Nguyen said, there's always a case where, some of these new innovative techniques does not work or is not applicable. But when we see every patient, we try to think that way. You know, what we hear from our patients, what pain do they have? Most of the people think that pain is just a physical pain, like can't walk, cannot put our foot down. You know, bed sheets hurt my pain at night because I have an ingrown nail. But, you know, from what we have learned in the last 15 years, you know, there's also an emotional pain to foot conditions, such as, like we said, we had a grandpa come in, no problem with crooked toes, crossed over toes.
Living
But-
with it for 10 years.
Yeah, living with it. The reason he had it fixed was because his grandkids do not want to be near him because they were afraid of his crooked toes. You know, there's an emotional part to it. You know, there are patients of ours that wanted to wear certain type of shoes. And I'm not talking about 4-inch heel stilettos or anything. They just want to be able to wear different type of shoes rather than just be able to wear one kind of shoe, one shoe their whole life for the last 10 years. We have patients like that who says, their closet is like Inspector Gadget. Every shoe looks alike. It's like they have 5 pairs of shoes exactly alike because that's the only shoe they could wear. They cannot do anything where else. They wear the same shoe to a wedding. They wear the same shoe to a funeral. They wear the same shoes to a graduation. So it's not only physical pain that we manage, fix, reduce in our patients. You know, again, times has changed, people have changed. We're more aware of our health nowadays. So there's an emotional component to what we help with our patients as well. So yeah. And as a final note on Onifix, for example, we trust Onifix so much, we did it on our 7-year-old who has an ingrown nail. Stay tuned for that YouTube video. It's coming out. You know, so it's safe enough for a 7-year-old, and he gave us a testimonial, an impromptu testimonial. So stay tuned for that, you know, 45-second to 2-minute video on what we did with Nathan, our 7-year-old, and we apply Onifix on him.
Yeah.
So, yeah.
Yeah, I mean, yeah, so yes, shout out to Don. Thank you, Don, for signing in. Velvet, oh, very nice seeing you joining us.
Dr. Shea.
Dr. Shea, yes, that's another minimal invasive surgeon out on the West Coast. Thank you, Tim. Thank you for joining us. Jana,
Thank you for logging in early.
Yeah,
Thank you.
yeah.
It's way early there
Yeah,
on the left coast, as we call it.
Jana, Sarah, Robert,
Yep.
Barbara, Stanley, and Rosanna. Yes, yes, and also WRNJ. So yeah, those are, you know, I would definitely appreciate all your support. You know, I don't think that we ever, like, beside thanking to our staff, you know, to get us where we at in 15 years. And I think we have to thank our patient as well.
Absolutely.
I mean, without
Absolutely.
them, I don't think that we have beaten beyond.
Right.
Really, without them, that we don't know that if we can have the motivation to come to the office every day and be able to provide the care and quality care to the patient. And well, thank you so much, TJ, for joining as well. TJ is my mentor, and he kind of like guide us through how the whole process of really transforming our practice. So thank you so much, TJ. Yeah, so it definitely is, you know, it is kind of like we've been through so much, and we did a lot of trial errors. You know, we were having 2 offices. We went from part-time office to full-time office. We work in the hospital. We traveled to facilities. And I think that we did participate with all different insurance that payers. And I definitely, to sum up, is that this pandemic, really a silver lining of it is actually we have time to reassess our current situation. I know that Dr. Zhu and I, we will always have time for a patient, be able to deliver the quality care. But I think that the big key that, like, how can we deliver the quality care if we so burn out? We see so many patients that we're not really there for them, you know, and for me and Dr. Zhu, like, we walk out the exam room, we would like to feel that we make a difference. We make their visits worthwhile. Because when they come to see us, our patient call us committed to the visit and share with us that some of the most intimate fear or concern about their feet. You know, that is a privilege. And I don't know any professions like other than being doctor, you know, you have that privilege. Just people just share that most intimate like concern about their body.
I have patients who told me that I'm their shrink for their feet. You know, I have spouses who told me that, you know, you're his or her shrink for my spouse's feet. Because all, you know, the only, you know, as a spouse or somebody who lived close to somebody, you see your loved one or your family member hurting, right?
Mhm.
But sometimes it's really hard to talk about it. Sometimes we don't want to talk about it. So when they come to it in an office setting like this, again, we sit down with our patients to talk to them. That's the first thing we do. We don't even look at the person's feet when we meet a person, a potential patient or a current patient. You know, so it's one of those things that might be the first time they actually talk about their fear, why they don't want to get something fixed, what horrible experience their friends had in the past with their friends' feet. You know, so it's a very common, you know, thing that I hear in the office. You know, like, you know, my friend had this same thing. I don't want to get it fixed the way they had it done. I don't want to have surgery because I had a friend who, you know, had it done and 4 months later, they're still on a scooter. You know, ingrown nail, the nail will never grow back the same way because my friend or my brother or anybody who had it done. You know, so it's a concept listening to our patients. It's always needed. You know, again, we have been in practice for 15 years. It may seem a long time, but in the grand scale of things, it's not. But we have accomplished a lot. But we're not only doctors, sometimes we're patients too. You know, we go into the doctor's office for our own needs. We have a 7-year-old, so we go to the doctors. And I don't have to tell, you know, our audience or anybody else out there that, you know, a doctor-patient experience has certainly changed in the last 15 years, 20 years, 30 years. You know, I'm in my mid-40s this year. I remember, you know, when I was a teenager, coming to America, going to see a pediatrician was fairly straightforward. Going in, my parents paid, we got what we need to get done, and we went home on the same day, and we were happy as a clam. You know, the doctor-patient relationship has certainly changed in, you know, in the, I would say, you know, since HMO has come in. For those of you who remember the days that you pay your family doctor, you know, out of pocket. You know, you pay your dentist, pay your pediatrician, pay, you know, your, you know, specialist that you went to see. You know, that has transitioned. And I think it calmed down a little bit when everybody started to get insurance from, you know, their companies. And then I think it kind of went back into woke or conversation somewhere around right when we started practicing. You know, 2007, 2008, 2009, you know, the most common name was known as Obamacare. I think that brought the insurance issue back into conversation, and everybody knew about it at that point. What insurance did, how it helped. We all need insurance, as we know nowadays how expensive medical care is. And one of the common questions I get asked in the office is that, do doctors really like insurance? Do they pay you enough? When Obamacare was coming in, it was almost every patient was asking me, what is the doctor's feeling about Obamacare? That's what really brought insurance back or into, the examining room or into the office setting. And looking back, as myself, as a patient sometimes, as well as a doctor providing care, I would have to honestly say I'm neutral on the topic. Neutral meaning that I see insurance has a place in healthcare, definitely. You know, where's that place? Everybody is very subjective. I get that too. As a doctor, I would just say we look at insurance. We have a different name for the insurance in the industry, believe it or not. It's called a third-party payer. That's what we call insurance as doctors. When we go to conferences, we never use the word insurance. It's third-party payer. What does that mean? It's a neutral term, but what it means is that when I sit in a room with a 80-year-old grandma, talking to her about her condition, what I need to do, what is needed to implement the care, the third-party payer is also in the room, although they're invisible. Third-party payer meaning that they're the one who's going to allow the care, what is needed to implement that care, like pre-authorizations, what is needed to get a test done, like an MRI, an X-ray, or a procedure done.
Medications.
Or medications, right. If the patient is going to walk out to the pharmacy and get a medication, pre-authorization has to happen. So insurance, to the doctor's point of view, is a third-party payer. They're the one who are in control of payment, how certain cares are implemented, in the manner that's implemented, and how quickly it's implemented. And for better or worse, that is going to be moving forward in our future in healthcare. Whether it's Obamacare, socialized medicine, private insurance, cost sharing plans, there's also those out there. Whatever that is, it's a third-party payer. The third party meaning is the doctor, patient, and the third party that's also in the room, and it's also part of the process. Now, with that said, everybody have their opinion on what a third-party payer or insurance can do, will do, and what I usually tell patients and tell my family members, or even tell our staff, insurance or third-party payer, contrary to common belief, is not a healthcare credit card. It doesn't mean that the doctor wants to do something, the patient agrees to it, and it's done. Just swipe the card. It doesn't work that way. And I think that is when a lot of conflict and disagreements and roadblocks happen. Let's say if I see a 60-year-old with a lump on her foot or his foot, I need an MRI. That cannot get done on the same day. It has to go through processes. There might be pre-test that's needed, meaning I have to do an X-ray before an MRI. When the MRI is done, it had to be done a certain way at a certain facility.
Had to go through certain conservative.
Correct, because we have to go through certain conservative care, and it might be a month later before the MRI is done. How satisfactory is that? I'll leave it up to the audience, but for the doctor, that's not satisfactory. We got our training a certain way to implement care a certain way. So to wait and allow the patient to be in pain or allow a condition to go on without knowing what exactly is growing somebody's foot is not okay with me as a doctor. If I were the patient, I would be 100 times not okay. So that's why recently in our office, we made certain decisions on our third-party payers. And I always tell patients, it's not about the money, it's about the care. It's about the quality of care. It's about how quickly we could deliver care. It's about how quickly the quality of care and how quickly we could resolve your pain, your physical pain or your emotional pain or both. So we make certain decisions in our office, and not everybody likes it. I'm sure in the days of social media and how quickly things move, I'm sure everybody knows, a decision that's made, whether it's a business or personally, or things that are, put out to the world, not everybody going to like it. So, that's our feeling and our concept of thinking with insurance or third party payer, as our industry would call it.
Mhm.
And I have no problem talking to someone about our philosophy on insurance and third party payers. They do have a place, but sometimes, the conflict comes when it does not meet the goal that the patient and the doctor set. And that's usually when the conflict, the roadblocks hit.
Yeah, and I think that when we involve with insurance, there's a lot of background works for the doctor's office.
Mhm.
And usually human nature, we don't share with that difficulties or extra, like I wouldn't call extra, but the work that we put into a visit.
Mhm.
And even after the patient left the office, we still have abundance of like paperwork, authorization, phone call to insurance or third party to get approval for whatever the solution or the recommendation that we give it to the patient. And I think that most of the time that is actually make the doctors and the doctor's office get burned out.
Mhm.
It's not about the care for the patient, but like all the logistics behind the scene. That is make the doctors like don't want to be in medicine anymore. Don't want to be like, like I think that we went through a very like tough time when we had to make that decision.
Mhm.
That we love everything we do in the exam room, but when we walked out, it's like, oh my gosh, like all this paperwork, all those like forms, all those like phone calls and communication that we have to do extra to get the patient medication, the order that needed, or the
Mhm.
procedure that got approved for. And even that is not
Yeah.
a guarantee of payment. So,
Yeah.
so any of industry, what kind of work that we do that have like no guarantee of payment?
Yeah, I mean, getting an MRI, getting tests done, that's just one aspect of third-party payer or insurance roadblocks. We actually had a patient, I'm not sure he's still on, but we actually had a patient where he needed an MRI done. I had to talk to a doctor in Iowa who was employed by the insurance company or the third-party payer to review his case. I mean, think about that. A doctor who's reading notes in Iowa is in control of whether that certain test is done or not. And I, as a doctor, need a certain test in order to begin or continue a treatment on a patient. And that decision is not based on me, not based on the patient agreement to my proposal, but it's based on a doctor sitting somewhere else who never seen the patient, who I'm just talking on the phone and trying to convince this doctor to approve a certain test for my patient. Like, just imagine that scenario. If it was your foot or your parent or your loved one that's waiting for that decision, and it's all hinges on how well I could articulate myself, trying to convince another medical professional to approve this test or not. And I think that was a breaking point for me. And I'm sure Dr. Nguyen has a story herself, but that just kind of enlightened me on how disconnected sometimes a patient-doctor relationship is. And I think that's really the very important aspect to it, and why certain doctors' offices, certain facilities decide where they're going to go with certain insurances. In New Jersey, for example, certain health networks are partner up with certain insurances. Certain hospitals are not taking certain insurances anymore. Everyone faces that challenge. Every facility, every doctor-patient relationship faces that challenge in the upcoming years. So I think that is a very important thing when we start to touch on the insurance, or the third party concept.
Mhm.
And again, it's not about the money. It's about the work that is put in, and the concept of whether we are in line with our patients and providing the best quality of care.
Yeah.
Yep.
And we
So-
also see that whatever the third party is doing right now is kind of like get in the way of what we continue with our vision.
Mhm.
Because our vision is to care for the patient, to give the care, give them the best, our best of knowledge and
Mhm.
technology to get them back, be healthier, be
Mhm.
a better version of themselves and their family,
Mhm.
so they can be happier,
Right.
And when that kind of like hindrance that process, and I think that's when we really strongly make that commitment to, it's not hard, it's not easy for us, it's very
Mhm.
difficult, because we have to, some patients have different opinion, and of course, they're no longer our patients. But then, like now we want to focus on what is the problem that we can help them solve with their feet. And
Right.
focus on the problem conditions rather than let the insurance or the third party
Mhm.
dictate
Mhm.
us or how we feel, how we should be treated, and that sort of thing. So that is our vision from to do, and we would like to strive to meet that expectation for our patient.
Yeah, and it's also about sustainability too.
Mhm.
At this point, I want to thank everyone that joined us this morning. Thank you for those that have stayed on.
Right.
I hope you enjoy listening to us as much as we enjoy talking. Right? And on a brighter note, we look forward to the next 15, 20, 25 years, however long that we're going to continue practice and provide care for this community. Fee and Beyond is going to stay here in Hackettstown. We're not moving. We love where we are in New Jersey. Northwest New Jersey is the beautiful part of New Jersey. For those of you who do not know this part of New Jersey, please come to visit. All right, look up Warren County, New Jersey.
We as a headquarters of
But-
MMRs.
Yes, every M&M candy that in North America comes out of here, so you can smell the chocolate cooking 3 days out of the week usually. But we also look forward to the next 15, 20, 25 years that we're going to providing care. And sustainability is a very important thing. We have to be able to, be motivated to come to the office every day, providing the care that we provide to our patients currently and in the future.
Mhm.
And in order to sustain that, tough decision had to be made. It's not an easy decision that we made in Fee and Beyond and opting out certain insurances or third-party payers. And we also added certain third-party payers. So it's a give and take. But we do have to kind of keep our eyes open, ears open to what's going on in the world. We cannot change what's happened in the past, and we cannot change some of the decisions we made. We only could learn from it. I think what we learn is sustainability is important. Being part of the community is important. Providing the best care is important. Reputation is important. And again, thank you for those who have logged in. Thank you for our family who supported us throughout this whole process. Our family is very important. Our staff, team members. I don't call them staff anymore. I call them team members because I cannot do it without them. We work as a team here from front to back.
A work family.
From the moment you pick up the phone to call us and make an appointment until you leave, it requires a whole team. And, we want to thank all the doctors that has touched our lives, who have given us guidance in the past.
And the referring.
Right, the referring doctors who trust their patients to our care. There's too many to name. Some of them gave a start to our career, from our residency, and we still keep in touch with them, to our hospital directors and everything that we have learned. And, and again, like Dr. Nguyen said before, we want to thank our patients who trust their care to us. Without you, there would not be Feet and Beyond. There would be no reason for us to open our doors every morning.
Right.
You
And
know,
this is
so
really is our privilege.
right,
It's
it
a
is a
privilege
privilege
that-
to serve this community and
Mhm.
live in the community.
Mhm.
So that's kind of like my final thoughts. And we will continue to provide care at the most innovative, effective, and safest way. And I always have a closing remark saying, please take care of your feet because it's good for you. And for those of you who have foot problems or foot ailments, whether it's physical, emotional pain, you know what that means. And most of our patients who logged in this morning know what that means because, after they get their feet done, almost all of them say they wish they'd done it earlier.
Yes.
So that would be my closing remarks, and just want to thank you. And I look forward to the future of providing care to this community.
Absolutely. And Dr. Zhu, you kind of say everything I want to say. So
Okay.
I guess that's why it's teamwork make dream work, right? So, well, thank you so much for joining us this morning. Your very valuable time, be able to join us. So absolutely appreciate that. This is Dr. Zhu first social media appearance. So it had to be, he did a good job on that. So definitely give him a kudos.
I'm on YouTube and my Facebook Live on the same week.
Now I think this is a start. Like maybe he's gonna be the next social media star. All right, have a good day, everyone, and enjoy your weekends. All right, take care.